New weight loss drugs like Ozempic and Wegovy have exploded in popularity and are constantly making national headlines, from dramatic celebrity transformations to shortages and negative side effects. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about the effectiveness of these medications compared to weight loss surgery and when each of these treatments are most appropriate. With me today is Dr. Rob Kenney, a surgeon at St. Luke's Center for Surgical Weight Loss. Thank you so much for joining us.
Thanks for having me, Lindsay.
So, Dr. Kenney, obesity is a chronic, common problem. What does this mean and why is it so hard to lose weight?
So we know that obesity affects more than 40% of U.S. adults. And the reason obesity is so common is that we know that our bodies really do not have a mechanism to lose weight. In fact, we have the opposite. Our bodies really want to maintain weight and to slowly gain weight over time. So diet and exercise alone as a treatment for obesity only work around 5% of the time when you look at things over a long period of time. So it's a very common story that I hear from our patients is they start to diet and exercise, and it does work for the first 1, 2, 3, 4 weeks. And then they hit a weight loss plateau, even though they're still giving a very good effort. So the reason that plateau occurs is that as they lose weight, their body actually thinks something's wrong, and their body really fights against any further weight loss. So that's why it's so hard to lose weight with diet and exercise alone.
Well, some of these medications are kind of being promoted or shared as miracle drugs. Are these medications as effective as bariatric surgery? So
while the medications are very effective, they're not as effective as bariatric surgery. So often with bariatric surgery, patients can have weight loss in excess of 80 to 100 pounds. Whereas with weight loss medications, often they see weight loss of around 20 to 30 pounds. So bariatric surgery is more effective for patients that have more weight to lose.
Okay, now for someone who's considering these options, how do you know which is the better fit?
So oftentimes for patients, we recommend both, depending on their health situation. But what I counsel patients is to talk to their doctor, see what their goals are in terms of their weight loss, to see which path they should choose. And again, oftentimes it is both.
Okay. Now, are there any misconceptions about bariatric surgery that you want to dispel?
So the main one is that a lot of patients will think that bariatric surgery is an easy way out, when really it is not. Bariatric surgery is not a cure for obesity. It is a very powerful tool, and patients work very hard to use that tool. So really, they're doing what's best. Obesity is a medical issue, and so they're doing what's best for their health.
Okay, and how safe is bariatric surgery?
So over the last 20 to 30 years, bariatric surgery has become very, very safe. In fact, we know it's safer for a lot of patients to have surgery than to not have surgery. Currently, bariatric surgery has about the same risk as a cholecystectomy, hysterectomy, those kind of procedures.
Okay, good to know. What about misconceptions around weight loss drugs?
So again, they're not a miracle cure. Weight loss drugs, you do lose weight while you're on them, but to maintain that weight loss, you do have to continue that medication for a long period of time. And those medications also have side effects. Some patients have issues with nausea or vomiting. Sometimes it can affect the pancreas or other organs.
Right, good to know going into that. So what's your final takeaway message for those who are watching?
So I think the most important thing is that obesity is a disease. It's a chronic disease, and it does have negative effects on our health in terms of our cardiac health, increases risk of different cancers, can certainly affect diabetes. And that we do have new treatments in medicines and surgeries that can help patients treat obesity.
Okay, great. Well, thank you so much for joining us.
Thanks for having me.
To learn more about St. Luke's Center for Surgical Weight Loss, visit stlukeskc.org/weight-loss. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.